Mendens. I'm one of the long-serving physios at Prince of Wales. I'm the student educator in cardiopulmonary acute physiotherapy. We're going to do a suction via an endotracheal tube, via a closed suction setup, and also via an open sterile setup. The purpose of that is anyone that's intubated has a certain amount of just normal secretions in their lungs that can't pass the tube, so their impaired mucociliary clearance means they'll need regular suctioning either by nurses or physios. So in the intensive care, one of the many common tasks we have is suctioning people, and it's important to get some practice in on a simulation mannequin before you have to do it on a real person, so you can get all your method correct and you're comfortable with the situation, and so that it's just nice and easy and you don't have to worry about it too much. The thing I tell students is the hardest part about suctioning is realizing it's not hard. The next hardest part is putting a sterile glove on. Everything else is just a nice simple process. So when you come to your patient, always you chat to your nurse and you say, is it okay if I treat this person? And then you think, what am I going to need to do? So this man is ventilated, he's got an endotracheal tube, and he doesn't have anything attached on there like a closed suction, which we'll talk about later. So we're going to have to do a sterile technique with him. Now, first and foremost, before you do anything with the patient, I find to make everything simple, you have everything ready. So you turn your suction on. And you keep it right here so that you always know where it is. So it's always at one of my hands. If I'm on the other side of the bed, it's just right to hand. Now, the other thing we're going to need is goggles, 2 sterile gloves, and 2 sterile catheters. So the procedure comes after you've done all your physiotherapy and you've identified the need to suction the patient and they've got secretions and so on. It's all part of your usual assessments and treatments. So, sterile technique is very simple if you follow an orderly procession. So, we have goggles, which you put on for eye protection at all times, particularly when you're doing something like this. 2 sterile gloves and 2 sterile catheters, so that in case you make a mistake or you become unsterile, you can take it off, put it down, and use the other one without having to leave your patient. So, the next hardest bit is getting the sterile glove on. So, I took my glove off, I opened the package, which is always a bit messy, and we open it up. Now, this is palm up. My palms are sweaty, I always wave them around. The other thing we need is the catheter. I'm going to attach my catheter very simply as such, and just use my leg to stop it running away. So the sterile glove, open it up, fingers nice and straight, fingers in first, and then grab the end of the ring and pop your glove on. Sterile hand, unsterile hand. Lift, and just follow upwards in an orderly fashion. I hold this end like a pen, and that's the endo suction ring. So, obviously, check your patient's numbers, heart rate, sats, blood pressure. Identify that they have sputum, and what we're going to do is insert the suction catheter, keeping this hand sterile. We're just going to go in, don't point it at yourself, don't point it at the nurse, just point it down the bed. Insert the catheter down till you get a cough, and press the suction, and come back in a slow, orderly fashion, making sure you catch as much stuff deep in their lungs as you can. Only suctioning on the way out, don't suction on the way down. Keeping an eye on the patient's numbers. Yep, they're okay. And then as you get a bit further up into the tube, you can come back a bit quicker and pause. So sometimes there's still more sputum in there and you have to go down again. So we're going to do a second pass, not suctioning on the way down. Insert the catheter again, knowing how far you had to go to get a cough the first time, try and get there in a fast and orderly fashion. And cough, and keep an eye on the patient, glance at your numbers, check your mirrors like if you were driving, suctioning on the way back, and we're done after 2 passes, say, all the way out. Wrap the catheter around your hand, and discard it, and that is a sterile suction technique. Most of the patients in our ICU have a closed suction setup, which makes your life much easier in terms of suctioning. You just have this device and you don't need any of the sterile equipment that we had before, but as always, it's important to turn your suction on before you do anything. So this is a closed suction setup, so it's all fully enclosed, and this end is where it has a locking mechanism, so always make sure it's not locked. This particular device, that's how that works. And then we pop the cap off. Your suction goes on this end. Again, you can use your leg to stop the tubing running away and just lay it out nicely. So when you have to suction somebody here, it's all self-contained, just needs to be the same technique you were using before of going down until you get a cough, and when you do, coming back in a slow, orderly fashion. So my right hand protects the airway at all times, my left hand comes back slowly to begin with, and then a bit quicker as you're coming back up the tube. The same technique you were using before of going down until you get a cough, and when you do, coming back in a slow, orderly fashion. So my right hand protects the airway at all times, my left hand comes back slowly to begin with, and then a bit quicker as you're coming back up the tube. And you finish suctioning, and that's it. It's much simpler.